Have you ever wondered what you can do to communicate with veterans who may have dementia or other cognitive impairment? This video will increase your awareness and understanding of how the person with dementia or other cognitive impairment experiences the healthcare setting, provide you with skills to recognize and act when a veteran seems confused, disoriented, or is having trouble with his or her memory, and show you specific strategies to communicate more effectively with veterans who may have dementia or other cognitive impairment. Significant numbers of veterans have dementia or other cognitive impairment, and the numbers are increasing as the veteran population ages. Hospital staff may have limited knowledge regarding dementia. Avoid communication, communicate ineffectively, increase frustration for both parties. Effective communication is fundamental to quality health care, which is provided by all VA employees. Research shows that training dementia communication strategies has a positive effect on job satisfaction. Cognitive impairment is when people have memory or thinking problems greater than normal for their age and education. Dementia is a type of cognitive impairment that involves the gradual loss of memory, thinking, and reasoning abilities to the point that these losses interfere with social and occupational functioning. Dementia warning signs that clinicians may notice. Is the veteran inattentive to appearance or unkempt, inappropriately dressed for weather or disheveled, a poor historian or forgetful? Dementia warning signs that veterans and caregivers may report. Asking the same questions over and over again. Becoming lost in familiar places. Not being able to follow directions. Getting very confused about time, people, and places. Problems with self-care, nutrition, bathing, or safety. If you recognize any of these dementia warning signs, the patient may or may not have dementia. An evaluation is needed to rule out other illnesses that can present with similar symptoms. But the veteran does need your assistance. Act using the Start Making Sense communication strategies. Good communication benefits all patients. Next, you will view a brief video that depicts a day in the life of a veteran visiting the VA Medical Center. The video depicts a series of typical healthcare interactions, including how the veteran experiences these. This is followed by a reenactment of the day, but this time implementing the Start Making Sense strategies.
All of us who work for the Department of Veterans Affairs can and should do our parts to communicate effectively with all of the veterans we encounter each day. Have you ever wondered what to say when you encounter a veteran who may seem lost or confused? This film will show you what you can do to talk with veterans who may have thinking difficulties or dementia. The purpose of this video is to help you learn specific strategies and techniques to enhance communication with veterans who may have memory or thinking impairments. You will see two versions. First, you'll see a typical set of interactions, and then you'll see a set of interactions where the VA staff use good communication skills. It is our job to help our veterans receive the best health care possible when they visit our medical center. Effective communication is fundamental to making sure we provide this care in ways that will best serve our veterans. Henry James is a veteran. Now in his late 60s, he has typical hearing and vision losses, and he's mildly depressed. Mr. James is fully mobile and appears quite normal when going about his daily routine and his environment, which only helps mask the difficulties he's having with understanding basic communication. On this day, he has come to the VA hospital for his monthly visit with his primary care physician. Navigating the complexities of the hospital environment can be challenging for anyone, but as you will see, with his impairments, which are not obvious to the casual observer, even the most basic interaction can become an overwhelming and frustrating experience for patients like Mr. James. People who work in healthcare settings like our VA Medical Center will encounter individuals like Mr. James every day. In this video, you will learn skills and strategies to help you communicate more effectively with patients who have mild cognitive impairment or dementia. You will view a typical day in the life of a veteran visiting the VA Medical Center. You will view two versions of the same visit. In the first version, Mr. James interacts with staff who have not been trained in the use of effective communication strategies. The second visit portrays the same encounters, but the staff are now using effective communication strategies. As you accompany Mr. James on his hospital visits, pay attention to the communication styles and techniques used by the hospital staff and personnel he encounters. Ask yourself, how can I use some of these techniques in my daily interactions with patients?
I'm going to the ladies' room. I'll meet you in the lobby.
Here you go, pal.
What is this for? Where the heck is she going?
Right, hold on just a second. Yeah, don't worry about that. I know Dixon's hurt. Oh, they bringing Leftwich back, man. Don't even worry about it. Still, it's gonna be great. All right. Yeah, hold on. Can I help you?
Can you throw this away from me, please? I'm supposed to go to the Bronze Clinic.
Okay. The Bronze Clinic's not in this section. What you want to do is head down this way. If you get to the canteen section, you've gone too far. But don't worry about that, because there's elevators across the hall. Just turn right and just ask somebody up there. You'll be fine. Go ahead. Yeah, just, and when you, remember, you see the elevator, turn to the right, okay? And go all the way down, okay? And if you see the soda machine, okay, you've gone too far, you want to head back the other way, okay? And there's a gift shop, you can ask someone there too, okay? All right.
Hey, your son James.
Yes?
You need some help?
I'm lost. I'm headed to the clinic.
Come on, I'll get you there.
Okay.
When the last time I saw you here?
I don't know.
The place has changed a lot. See, the clinic's in the new section, and the lab is down the hall in the old tower.
Okay. Well, my wife's supposed to meet me here. I need the clinic?
Well, she'll be here sooner or later.
Okay.
Come on.
Go left, right? What does this guy want me to do?
Hold on, I'll get to you. Did you sign in already? What's your name, sir? What's your last four? Hold on. Hello? Hey. Yeah. Yeah, just get me a tuna salad. Okay, no problem. Bye. What's your last four, sir?
My wife does the paperwork. Clara, I don't know where she is. My last four?
Hold on. I'll call you back. All right.
I'm Henry James. I have an appointment.
Henry James. Mr. James, you were supposed to get your blood work done first. You need to get your lab test done first before we can see you here. So just head on up to the lab right quick and then bring the paperwork back here. And you're already late, so head up there right now. Hey. Yeah.
Are you here for your diabetes screening? Are you Mr. James? Just a second. I see that it hasn't been done yet. We'll go ahead and get some blood. Do you remember what they told you the last time you were here? Has your diet changed significantly? Your weight, your appetite?
I don't remember, but my wife would.
Will you go ahead and take Mr. James back to the lab, please?
Mr. James, come on around this way. We'll get you started, okay?
Okay, Mr. James. I'm just going to get a couple vials of blood from you today. Okay. Tie this tourniquet tightly here.
All righty, hold that fist as tight as you can get it.
What is all this stuff for?
Relax.
What am I supposed to do? Squeeze? Relax? How much are they gonna take?
Clean that site there a little bit. And today, the doctor only wants a green and a gold top tube, okay? So we only got two. Okay.
You can head back down to that clinic now, okay?
Thank you.
Have a good day.
Excuse me, sir.
Mr. James?
Can you see my wife?
No, I haven't. Now let me get you to the right place. Your appointment was 15 minutes ago.
Just looking for my wife.
Hi, Mr. James. I'm Carolyn. How are you?
Hi.
Good. Now tell me why you're here today.
I think my wife is lost. Can you see if she's out there?
I'm sure she's fine. Now, you can't remember why we're seeing you today?
No, but my wife would.
Well, that's fine. Let's go through these medications. I need to make sure this chart is right. Now,
I don't know what to tell her. Clara does my meds. I just take what she gives me.
Oh, hi. How are you? We were just going through medications. Now, it says here in the chart, the last time you came in was for a sleep disturbance. Is that right?
I don't know anything about that. I don't have a sleep disturbance.
Yes, he does. He just doesn't remember, but I do. He gets up at night and can't go back to sleep.
And what about the nocturia and the night sweats?
I get hot sometimes, but I don't hear any knocking or anything like that. I mean, is that what you mean? Nocturia?
Tell her about getting up to pee and how wet the sheets are.
I remember something like that.
You can't remember hardly anything lately. Here's what he does. He falls asleep okay, but then about 2 or 3 o'clock in the morning, he gets up and he just...
Why do they need to know all this anyway? This is taking too long. Does she really need to go on about that?
We end up with a policeman bringing him... I just worry about him.
Well, you all sit tight. Dr. House will be right with you.
Hi, honey. Welcome. Good to see you. How's your heart palpitations?
She sure is young for a doctor. She could be my daughter. Yeah, it sounds like I have a lot of problems.
Do you need more medicine adjustment?
Now they're changing my medicine?
And there's the other things. He'll leave the stove on. He'll forget where he puts things. I'm supposed to go to my sister's next week, and I don't know if that's a good idea.
Mr. James, we'll have to have you talk to a social worker about that. I'm going to get the medicines changed, and I'll see you later.
Where do we have to go now? Social worker? I need to go to the John.
So, he's having some mental health issues, memory, that sort of thing?
Oh, he's forgetting things all the time. He's losing his keys. Last week, he forgot the name of his grandchild.
Okay, sweetie, Dr. House has some concerns about your cognitive abilities, and I think this is going to take some more testing. So I'm going to recommend that you see a psychologist.
They sure are nosy about my personal life. More tests? Hope Clara understands all this.
Do you know where the car is?
Did you keep the ticket?
A patient with mild cognitive impairment or who is in the early stages of dementia, like Mr. James, will find even simple conversation confusing and frustrating at times. When we don't recognize this confusion, we fail to meet the needs of our patients who deserve our best effort to provide them with information that is meaningful and helpful. Learning to communicate in ways that help our veterans understand can reduce frustration and assist them in taking the best possible care of their health. That's why it's important for VA staff at every level to recognize the signs of confusion and frustration that can result when a veteran with even mild cognitive impairment is trying to navigate our medical center. There are many things we can do to adjust our communications to better fit the needs of the veterans we encounter and serve every day, and do so in a respectful and helpful manner. By recognizing some of the signs and symptoms of cognitive and sensory loss, we can modify our interactions with patients to improve what, as we have seen, can be a confusing and frightening experience. We can do this by taking some simple steps to improve our communication. Let's take another look at Mr. James' visit to this VA hospital and see how effective communication techniques can accommodate his condition and his needs.
I'm going to the ladies' room. I'll meet you in the lobby.
Here you go. Just leave the car with us. Welcome to the VA. I'm going to help you get to the right place. What's your name?
Henry James.
Mr. James. Charlie, can you take this one? Mr. James, you're going to keep this ticket in your pocket because you're going to need it when you come back. Now, if you just follow me, I'll take you to the information desk.
A couple of important events just took place. The valet was quickly aware of the situation. He has been trained to recognize and address the confusion some older veterans might exhibit. He was respectful of the vet, welcoming him to the hospital, and when he spoke, he looked right into the veteran's eyes. There was no doubt who he was addressing, and he made sure the veteran knew what he was supposed to do next.
Yes, ma'am. Oh, you're welcome. You take care and have a nice day. How can I help you, sir?
I'm trying to find the clinic. Can you tell me how to get there?
Yes, sir, I can. I'll be right with you, sir. Okay, the clinic is in the new section, but it's not hard to get to. Here, take a look at this map. We're here. You want to follow the arrow all the way down, and it'll take you right there. Okay? Now, do you have any questions? Okay, I'll tell you what. I'll get Chuck to show you where things are. Chuck, can you help us out over here? Mr. James is trying to get to the Bronze Clinic. Can you show him how to get there, please?
Sure, I can.
Okay. You're in good hands.
Yes, sir, please.
Thank you. Take care. Have a nice day.
A trained information desk worker can make a huge difference. Using visual aids, like the map, are very helpful, and much of the confusion of the front desk can be eliminated by communicating in close proximity and using direct eye contact. These techniques will help the veteran hear, focus, and better understand your communication efforts. One major symptom of dementia is lack of concentration and a reduced ability to deal with competing stimuli, resulting in sensory overload. Confusion and frustration will be the result if efforts are not taken to simplify the environment. Finally, if needed, find someone to help you if you cannot directly assist the patient.
Well, let me get this map. That way, if you get lost, you'll have it take you exactly where you need to be.
Okay. Well, you know, my wife was supposed to meet me here.
Well, let me get you to the lab. We'll get things taken care of, and then we'll find your wife. Everything will be fine.
Okay.
Okay?
Okay.
All of us play an equally important part in helping the veterans and their families who come to the VA. We are responsible for recognizing and meeting the unique needs of our aging veterans and learning how best to communicate with all our patients. Notice how Chuck reassures Mr. James by walking with and not in front of him and using a calm, friendly, reassuring conversational technique as he guides the patient to his clinic.
Good morning, sir. Tell me your name.
Henry James. My wife was supposed to meet me here, but
Yes, sir. We have your records here. They've scheduled some blood tests, and we'll need those before you can come here. Excuse me for a second. Geriatrics Clinic, can you please hold? Yes, thank you. I'll tell you what, I'll look out for your wife and let her know where you're at, but let me show you where the lab is and we can start from there. Yes.
Notice how helpful the program support assistant was in the last scene. She realized Mr. James was confused, so she adjusted her communication style. She made him the focus of her attention by acknowledging him right away, engaging him directly, and minimizing other distractions, like the telephone. She made him her priority. Even though she was extremely busy, she got him reoriented, redirected, and addressed his concerns in a reassuring manner. It's all part of effective communication.
Can I help you?
They sent me up here, but I don't know why. My wife is supposed to meet me here.
Oh, are you Mr. James? Don't worry, Mr. James. You're in the right place. Will.
Yes.
Can you please help Mr. James with his lab work?
Sure, Mr. James. We'll get your lab squared away, and we'll have you back down in your clinic in no time.
I don't know if I can find my way back.
Oh, don't worry, Mr. James. We'll get you back to your wife. Do you understand? I know the medical center can be a little confusing, but we'll get you taken care of.
Okay.
It's important to address every concern with clear, concise, and simple answers. Establish eye contact. Slow your rate of speaking. Enunciate and verify their understanding. Acknowledge the patient's feelings when appropriate. A person with dementia can become confused and overwhelmed. Efforts to actively engage them and empathize with them through a kind word will help calm them so they can focus more clearly on the task at hand. Pay attention to your body language and nonverbal cues. A smile can be very helpful.
I don't know anything about. I don't know anything about that. I don't have any sleep problems.
He has sleep problems. He just can't remember. Did he tell you about how he forgets where he puts things?
That's good to know. I want to ask Mr. James some questions. Are you feeling okay?
I'm feeling okay.
How's your appetite?
It's good. It's okay.
And how are you sleeping?
Well, I wake up sometimes. I can't go back to sleep, but I don't know.
That probably makes you tired during the day. It can be very uncomfortable. We have some things that can help with that.
Even though the wife has returned, the nurse continues her conversation with Mr. James. Family members are key participants in our veterans' health care and should be involved in the discussions. However, the veteran is always the priority. The nurse carefully directed her comments and questions to both Mr. and Mrs. James without ignoring either one. She asked simply phrased, easily understood questions and waited for the answers, giving Mr. James time to process the information before asking the next one. Try these techniques next time you're helping a patient. Finally, in the second version of this encounter, the nurse faced the couple, not the computer. Place the focus on the patient and not the computerized medical record.
I'd like to try a new medicine at night to see if we can help you sleep better. What time do you go to sleep at night?
Around 9, I guess.
This would be one pill that you would take just at bedtime. You'd leave one pill at your bedside every night, and that'll help you remember to take it. To make sure that I have explained this, can you tell me how many times a day you'll take this medicine?
Once before bed.
And I'm sure Miss James will be there with you to help you remember.
Okay.
I've also written the instructions down for you, so when you pick your medicine up from pharmacy, you remember how to do it. Now, I'd like to go get the social worker to come speak with you. Is there anything else I can answer for you today?
I don't think so.
Great. All right. I'll get the social worker, and she'll be in a little bit. It was nice seeing you again.
Thank you.
Notice the doctor has positioned herself directly in front of the family, away from the glare of the window and right on the same eye level, instead of towering over them, as she did in the first vignette. She also addresses him respectfully, no longer calling him honey. Dr. House has been careful to include the patient and his wife in the conversation. The patient is addressed directly to communicate he is an active participant in the healthcare planning process. The doctor also ensures understanding by having the patient teach back the medication instructions. Finally, she writes the instructions down for them to help them remember these important instructions later. Let's revisit Mr. James' meeting with the social worker. The social worker talked to the wife as if Mr. James wasn't even in the room, ignoring him entirely. Our focus should always be on the veteran. She mentions mental health and cognitive issues, which only serve to confuse him further. And although well-intended, calling an American hero Sweetie is not any more acceptable than the doctor's use of honey in the last encounter. It is inappropriate and could be viewed as patronizing or condescending. Our patients deserve our respect, and it starts with our language.
Mr. and Mrs. James, I'm Ellen Jensen. I'm the team social worker, and Dr. House would like for me to speak with you. How are you doing today?
He seems confused all the time. I just don't know what I'm going to do.
Okay, thanks. I'd like to start by asking Mr. James some questions so I might best know how to help you. Please tell me about when you started to notice some changes.
The social worker needs to develop a full psychosocial history of the patient before addressing specific problems. A lot can be accomplished in a short interview.
It sounds like there have been some changes recently, and I think that's something we can help you with. May I tell you how we go about doing that?
Okay.
Well, first, I would recommend that you meet with our psychologist. He'll ask you some questions, and that will help us give us a clearer understanding of what treatment might help improve some of the recent changes. How does that sound to you?
Sure.
To make sure I've explained this all right, can you tell me what our plan is?
You want me to meet with a psychologist to help me with the recent changes, right?
Great. Are there any other questions you all have about the plan?
I don't think so.
All right, let me give you my card. And if you think of any questions later, please don't hesitate to call me. And if it's all right with you, we can go ahead and set up the appointment with the psychologist.
Okay.
The social worker took the time to establish rapport with the vet, treated him with respect, spoke directly to him, and explained the process clearly without overwhelming him or his wife with details. And importantly, she made herself available for questions. Her treatment suggestions allowed for empowerment and active participation by the patient. Take a look at these key phrases. They can become everyday guidelines for all VA employees to help us better meet the needs of the aging veterans we serve. Early recognition. Be aware that some of our veterans may appear confused or disoriented. At that moment, our method of communicating has to change when you see a veteran who seems frustrated, confused, or lost. Act and use these communication skills. Don't argue with a veteran. We are here to help and not to frustrate. Respect. Remember who our patients are. America's heroes. They deserve our respect. They are Mr. or Mrs. or Miss, Sir or Ma'am, never sweetie or sport or buddy or pal. Show respect. Reassure the veteran it will all be okay. We're here to take care of you. Look the veteran in the eyes and make sure they understand you. Walk beside, not in front. Stay physically close and use nonverbal communications such as a smile, a handshake, or a touch to help with your encounter. Direct and deliberate communication. Your speech should be slow, clear, and easy to understand. Simple is better. Give simple instructions, one at a time, and have the veteran repeat important details. Repeat anything that doesn't seem to be understood. Use visual aids to help with communication and instructions, and write instructions down for future reference. Avoid complicated medical terminology and jargon, and offer only information that will help the veteran understand the situation. And finally, communicate effectively. What you are doing at the moment of this encounter is important work. Put all your other tasks on hold while you're assisting a veteran who needs your special attention and care. They're here to take care of their health. You're the link to their mental well-being in these important moments, and they deserve all the time and comfort you can give them. You'll get rewarded in small ways for doing what is a big part of what makes the VA a special place to work and a special place for our veterans to come for their health care needs.
Oh, where did you put the valet ticket?
I put it right here in my pocket so I wouldn't lose it.